I'm really excited for you to get to hear from Josh. He has a background in student ministry and media at places like Seacoast and other churches, but he's also the founder of the Business Savers Alliance. And so I'll let him tell more about it because he knows a lot more than me. But man, we have been just so grateful for them in the Spire network to be able to partner with them in a space that allows so many churches to be able to save so much money. So thanks everyone for joining us. If you have questions that come up or you had one that you were thinking about coming here, please use our chat feature, and we'll have a portion at the end of our webinar to be able to get to those, as well as ways to be able to access Josh and Gabe directly. So without further ado, I'll let you take it away, Josh.
Yeah, thanks so much, Chaz. We are excited to also be partnered with Spire. I love your mission and your vision at Spire to encourage and equip leaders. This is going to hopefully give you some equipping today. I don't know how encouraging I can be about the current system. Well, maybe you'll find some encouragement. Maybe there will be some options and some strategies you hadn't thought of before that are going to save you some money, like some of the other churches that we've been working with. And then I love the idea that it's through practical ministry support. And again, I love everything that Spire does. Was really impressed at the conference with some of the technology and the tools and things that they're doing. And hopefully we're going to talk about some practical resources for you as well. As Chess said, my background, I actually was in ministry myself for 5 years, full time, and then got married, started having children, and needed to supplement that income. So I started selling insurance, and then God called me into that full time. And so my dad's actually a pastor. He's celebrating his 50th year in full-time ministry, 71 and still going. And so I grew up in the church. And then obviously spent the last 20 plus years in insurance. And so when God really gave me this vision about 2 years ago to bring these strategies and these solutions to the church, not only was it to empower and equip the church by creating some savings that could be used for building the kingdom, but we also committed to really doing all of this through nonprofits like Spire, where the majority of the revenue generated by any activity we do goes back to the nonprofit. So it really is a win-win. If we're able to work with you, I just want you to know that's exactly what our model is. We're trying to help you save money so that more is invested in the kingdom, and then any thing that an insurance agency or one of these strategies pays us, we give half of that, more than half of that, back to the nonprofits. And so that's really what our model is. But let me jump into the health insurance side is what we wanted to spend the most time on today. And the reason is there was a Wall Street Journal article about a month ago that said that this is going to be the highest renewal season in 15 years. And so churches we've already been speaking to this week are seeing north of 20% renewals. And it just doesn't have to be that way. Most folks are looking at traditional group plans, or a lot of the churches we're talking to are doing nothing for their employees, and their employees are on their own in the marketplace. And there's a lot more that you could be doing. We're going to talk today about an ICHRA or QSEHRA strategy. If you're not sure what those are, hang tight. We'll talk about those. There's obviously Christian healthcare sharing ministry plans. But I also want to highlight a program we've specifically built for churches and ministry leaders, marketplace leaders that are in your church, if you have 5 or more employees. And then we do have a program for self-funding for groups that have 50 or more employees. And then this Kingston Preventive Care program, my own church has been on it for 3 years, and really excited to bring that information to you as well. So we're just going to spotlight a few of those, and then answer some questions you have, and then really encourage you, if you want to learn more about how we can help you specifically in your church, we'll set up a 15 to 20-minute phone call to do that. The idea behind a captive is that instead of just buying an off-the-shelf insurance plan from the carriers that you know of, like Blue Cross, Cigna, Aetna, United, the idea of the law of large numbers, pooling everybody together to spread the risk, works without those guys. We might want to use them for their network and what they've negotiated from a price standpoint. We don't have to have all of the costs that are built in there if we have a large enough group. We also don't have to have their marketing expense, and they're publicly traded companies, and have to turn a profit. And so we've worked with a third-party administrator who actually, takes the money, adjudicates the claims, pays the claims. But we also have A-rated insurance carrier that gives us a stop loss. And so that could be in the aggregate. So if a bunch of claims equal our limit, or if one big claim comes in, we do have an A-rated insurance carrier to pay for that. But for the majority of the smaller claims, the premiums that we take in are able to be paid out from that claims fund. And then if there's money left over, we can carry that into next year and not have a rate increase. What usually happens with a captive is after a couple of years, there's enough revenue and in that, and enough excess in that claims bucket that we can actually start giving refunds. So instead of an increase in your premium, you might actually get a dividend back that the program is doing so well. And so we've worked with some folks, a carrier and a TPA that I've known for many years that have worked in this space and built a plan just for these churches and for faith-based marketplace leaders as well. They do use the Cigna network for the majority of your claims. Your doctor visits, your insurance card will have the Cigna logo on it, and that's who they use for the pharmacy as well. But on top of that, this company we're working with is called Vault, and they have their own network. And what they're doing within that network is really trying to eliminate a lot of the errors, poor outcomes. If you look at some of the statistics, unfortunately, half of all medical diagnoses are wrong. And so if we have someone that's taking a little bit more care, that's looking into exactly what those claims are, getting second opinions, if there's complex care, working with us on finding the best solution, then we're going to be in a much better position. The other thing I love about working with Vault is they have a preferred relationship with the Mayo Clinic that they actually extend to the congregation members of participating churches in this plan. And so the way that works, they would obviously have to have their own insurance. They're not going to pay the claim. But if I were to be on a Blue Cross plan or United plan and need to go to the Mayo Clinic, if I'm diagnosed with an aggressive form of cancer, I want to get there as quickly as possible. It's on average 2 to 3 months before these major carriers could get me an appointment there. If you called me tomorrow and said, Josh, I've got a member of my church that needs in the Mayo Clinic, I can get them in within 24 hours with this Vault Cares network. Again, they have to have their own insurance. They have to be able to have that claim be paid, but it's really the access that they have that's special. And so Vault really is a trusted partner with us. They're a ministry partner, helping us not only care for the churches and the church staffs and the marketplace leaders and businesses that are a part of your church, but even just any congregation member that needs that sort of treatment. For this first year, we've put together 2 plan designs. We will be adding some plan designs to this in the future, but the most popular plans we saw were being asked for were kind of a silver plan, and then an HSA plan. So a little bit higher deductible. Once you've met your out-of-pocket max, everything is covered 100% on the HSA plan. And then the silver is more of a copay driven plan. So $10 copay at the doctor, $50 for a specialist, $75 for urgent care, emergency room, $150 plus 20% coinsurance, has a prescription card. And those plans have underwriting, which would determine exactly what the tier is that the pricing would be. But I just wanted to share this with you because we're not trying to sell you something or present something to you that is of no value. We definitely wanted to see if there's some savings here for you. We would want to talk to you about this plan. If not, one of the other strategies might work. But if you take a look at the national average right now, it's about $2,400 a month for a silver plan for a family. And so this is well below that national average. For single, it's about $800 a month, so we're still below that. And then on the HSA plan design, which is the plan design I prefer, I take the difference in the premium and just put that into a health savings account. A lot of the churches, we talked to a church this week that's on a health savings account plan already, and they were going to see about $500 a month in savings by switching to this plan, and just be able to move that straight into the health savings account. So the first $6,000 every year of medical expense is there. It's available in a health savings account, even before they have to worry about coming out of pocket to reach that deductible. So these are some great plans. We're really excited about this. We believe these are going to be some rates that are very stable over time. You won't be seeing these big 20% rate increases in a captive type plan. The second strategy I want to talk about is this Kingston Advantage plan. This is for groups that have 10 or more employees, and what it is, it's a pre-tax preventative care program. It does not replace any medical or supplemental plans that you have. So if you've already got your insurance, if you've already done your renewal, none of that matters. You can simply lay this over anytime. My own church has 20 employees. They've been on this plan for 3 years. Absolutely love it. They've all been able to save quite a bit of money because there's zero net cost for the employer or employees with this program, because the pre-tax preventative care aspect pays for the whole program. This was part of the Affordable Care Act that would incentivize employers to promote preventative care. And so you'd have an app that's going to include telemedicine, over 1,000 drugs that you can get at $0. There's a weekly medical consult via email that each employee gets. And that has a CPT code attached to it, which gives it that preventative care designation. There's non-health benefits like identity theft protection, there's pet care, there's legal services. And then there is an actual insurance component that's an accident indemnity. And that's going to work kind of like an AFLAC or an accident plan, where it pays the employees cash if they're hospitalized or had a broken bone and had to go to the emergency room. There's a schedule that pays out. What's great about this plan is, without using any of the benefits, just for participating, every church is going to save about $100 a month per employee. And so for my church, that's about $2,000 a month that they're saving just for having this plan in place for the employees. Now, this is just the matching FICA tax savings that the employer would get. The employees also save on their taxes. The taxes that they pay go down, and that's going to depend on what their income is. But on average, it's anywhere from $50 to $150 a month in additional take-home pay that they're going to have, plus all of the benefits that are part of this program. So we'd love to dive into this a little bit deeper. If you want to learn more about that program and talk to you kind of one-on-one and show you what we would need to get started with that plan. When we got started with BSA, I wanted to find a partner that was licensed in all 50 states that could implement some of these strategies, that could provide a layer of customer service and support that exceeded anything that any normal insurance broker could do. And I was able to meet Gabe Pelfrey with Stewarded. Stewarded works with churches, ministries, nonprofit organizations. Gabe's become a great partner to us, has implemented some strategies that I hadn't even heard of, and he's going to share a few of those with you now. So Gabe, let me bring you into the call.
All right. Thanks, Josh. Thanks, Chaz. We are honored to be a part of BSA. We got a lot of experience working with churches on healthcare issues, on retirement issues, and working with Christian nonprofits and churches is a real specialization of ours. We understand the culture. We understand what's important to them, and we've developed some niches. The complexities of healthcare really go back to, there's not one silver bullet. There's not one solution that is best for every organization and every employee. So organizations have got to make decisions a lot of time on what's best for the organization as a whole versus what's best for maybe just a couple of employees that have really high healthcare spend. It's a real balancing act to get the organization to the point where they can provide quality healthcare for their employees, which is a goal of every church. but at the same time, make it where it's affordable and the church feels like they're being a really good steward of the dollars that God has given to them. So, we're a big believer in partnerships, and that's why we like being a part of BSA. We really try to go out there and learn what the problem is for each individual church uniquely. And then we built a platform where we monetize and we make money off of all of the different options equally. So we're not really trying to be incentivized to sell you group health insurance or an ICHRA or a QSEHRA. And you're going to hear us throw out all of these terms here in just a minute. But at a really high level, we're just trying to carry the load for the churches, really take the struggle off of finding and becoming educated about good quality health care and finding them a solution that's going to fit their need the best. So we really look at it as a partnership between us and our clients that's going to be an ongoing partnership. We're not just trying to come in and fix your healthcare for 1 year. We're trying to educate you about the best philosophy that you can go about to really make sure that you keep your health insurance costs as low as they can possibly be on an annual basis. Now, Chaz, do I have the ability to move the screen here or? Okay. So really what I'm going to talk about today, and Josh did a good job of covering some of the group health insurance options that are available in the marketplace. There is a large contingency of churches out there who really struggle to afford group health insurance. And they also struggle with the complexities of choosing one or two group solutions that are going to work well for their employee group as a whole. And that's really where the two next solutions that we're going to talk through can come about. The first one is a QSEHRA. All right, it stands for a Qualified Small Employer Health Reimbursement Arrangement. It's the most flexible of the health reimbursement arrangements that are out in the marketplace. And if you're not familiar with the QSEHRA or you're not familiar with what's happened with HRA plans over the last 6-year period of time, Congress has passed into law and they brought into existence two plans. The first one is a QSEHRA, and then we'll talk about here in just a minute something called an ICHRA. These are really HRA plans that are not designed to supplement group health insurance. If you go back 15 or 20 years, health reimbursement arrangements were originally designed to be supplemental to an organization to be offered alongside an organization that's already offering group health insurance plan. QSEHRAs and ICHRAs are really primarily designed to replace those plans. All right. So in a QSEHRA, you can't have more than 50 full-time employees. But what these plans really do is they bring a lot of flexibility into the organization. And the organization sets up a QSEHRA, and I like to think about it as a tax-free umbrella that you're basically putting over an HRA where all of the proceeds that are being contributed on behalf of the employee, and that's what's going on here, the employer is making a monthly contribution to the plan, and that money that's being contributed on behalf of the employee is payroll tax-free to the employer and the employee, and it's also income tax-free to the employee. So it's a way for an organization to pay for health insurance for its employees on a totally tax-free basis. Now, what the employee then gets is the flexibility to go out and pick whatever plan on the marketplace works best for them. And it can be either an on-marketplace plan or it can be an off-marketplace plan. You can also use minimum essential coverage policies inside of the plans. You can use ministry sharing plans inside of a QSEHRA. So what organizations like about it is they get to set what the budget's going to be on a monthly basis, and they can stick to that versus going to a group health insurance carrier and then setting what your premium is going to be on a monthly and annual basis. And I call it getting on the group health insurance treadmill. Just every year it goes up by 5%, 10%, 20%, 30%. You don't have that inside of these types of plans because the organization gets to set what their allowance is going to be. And then the employee gets to go out and pick the healthcare solution that works best for them. When we're working with a lot of employers that are looking to move away from group health insurance, one of the things that you'll find is whenever you come off a group health insurance plan and you give your employees the flexibility to pick what type of coverage and the cost of the coverage that they want to utilize for their health care, you'll find that most of them just want to use whatever amount that the employer is contributing to the plan. So what that tells us is a lot of employees inside of churches are interested in having major medical group health insurance plan as long as the organization will pay 100% of the cost. They don't want to come out of pocket for any of it. That's where these plans become very, very popular with the employees. It gives them the flexibility to manage their own healthcare spend on a monthly basis instead of it being dictated to them by their employer and by the health insurance company by just going out and picking a group health insurance plan. Chaz, you can go to the next screen. An ICHRA is very, very similar. What I would say at a very high level differentiates the QSEHRA, and we'll get into some more details here in just a minute. I see a lot of organizations that have not traditionally been able to afford group health insurance want to utilize a QSEHRA. All right. I see a lot of organizations that have a group health insurance plan and the deductibles and the premiums and the overall solution is not working out well for them, but they want to go back with something very, very similar to a group health insurance plan, but give more flexibility. That's where an ICHRA plan is going to come into place. So an ICHRA stands for Individual Coverage Health Reimbursement Arrangement. It does not have any employee count limitations on it. We've got organizations with one employee that utilize an ICHRA. We've got organizations with hundreds of employees that utilize an ICHRA. So there's no stipulation on how many employees that you have to have. It works very, very similar, but it is more restrictive on what qualifies to be included inside of the plan. So you have to have a major medical insurance plan. Your minimum essential coverage policies, your ministry sharing plans, all of those things that organizations use inside of a QSEHRA to keep their expenses lower, they don't work inside of an ICHRA. You have to have major medical insurance. So at a really, really high level, that is the difference between the two of them. But if we go to the next slide, we can talk a little bit more about some of the rules and what it means. We've already covered your eligible employers, QSEHRA, 50 or fewer full-time employers. For an ICHRA, any organization size can offer it. A QSEHRA, you've got IRS maximum reimbursement limits. All right. For a single employee, you can reimburse up to $6,150 for a single employee. And then if you've got family coverage, the maximum that you can put inside the QSEHRA is $12,800. There is no maximum reimbursement limit inside of an ICHRA. The organization can put as little as they want inside of it, or they can put as much as they want inside of it. There's no limitation there. What quality of coverage do you need to have to qualify as an employee? This is a big differential and differentiating factor inside of a QSEHRA. Inside of a QSEHRA, you just have to have minimum essential coverage. It's a much lower threshold for the employee to get over to qualify getting their tax-free health reimbursements. All right. Inside of an ICHRA, you've got to have either Medicare or a major medical insurance plan. So when you go to the next step, you say, okay, well, how do organizations really determine which one of these to use? And what I say to that is it's really what philosophy does the organization want to apply to offering health care for their employees? You can see spouses insurance. Whenever we go in and work with a church, there will normally be a large number of the employees that will be getting coverage through their spouse. Inside of the QSEHRA, the spouse's insurance, as long as they're having a cost for the employee, it can be brought into the QSEHRA and be reimbursed for. There's both a pro and a con to that. The pro is for organizations that say, listen, inside of our healthcare, we're really just trying to get more tax-free dollars to all of our employees to cover their cost. QSEHRA works really, really well. It benefits employees that don't have any coverage. It benefits employees that already have coverage through their spouse. Everyone gets a benefit out of it. The flip side of that, other organizations say, well, it's a con because we're really just trying to implement healthcare that's going to take care of our employees that don't already have a healthcare option. And the people that are on their spouse's plan, our employees that are on their spouse's plan, we're really not trying to allocate more benefit dollars to them. Who we're trying to take care of are the employees that currently aren't covered. So all the QSEHRA is going to do is run our expense up higher. Inside of an ICHRA, you don't have that problem because a spouse's group health insurance plan is not eligible to be reimbursed for. All right. The next big differential inside of the QSEHRA, whenever you're talking about cost differential, a QSEHRA, you can only have 4 classes of employees. You can have single employees, you can have employee and children, dependents, you can have employee and spouse, and then you can have family. Inside of those 4 classes that you can do, everyone has to be treated exactly equal. All right. That can cause issues because going out on the individual marketplace and getting coverage at a cost, being a 63-year-old and a 23-year-old, there is a huge discrepancy in those costs. So that causes some limitations with the QSEHRA. Inside of the ICHRA, there's 11 different classes of employees that you can design and unlimited different combinations of those classes. So not to get too far off into the weeds, but it essentially allows the employer to just really come up with classes that are very tight from a budget standpoint. So you can really target what your healthcare spend is going to be on a monthly and annual basis, and employers really like that. Inside of Medicare premium payments, either a QSEHRA or an ICHRA allow for those to be reimbursed for. So if you've got employees that are on Medicare and they want to get some of their Medicare or their Medicare supplements reimbursed for, that is easy to do inside of either a QSEHRA or an ICHRA plan. So these QSEHRA and ICHRA plans, where do they really come into play? Think about organizations that are on group health insurance and they've got really high claims. And the organization is struggling with every year the insurance company is coming back with more and more renewal increases. Inside of an ICHRA or QSEHRA, you take the claims that are being attributed to your organization, instead of them going on your group health insurance plan, you can switch them out onto the individual marketplace where you don't have to deal with the claims increases every single year. So we see a lot of organizations that have very high claims utilizing either a QSEHRA or an ICHRA. A lot of the pushback that we get on the plans, especially from the finance people or from people inside of HRA, that they've administered a health reimbursement arrangement before, they're like, oh man, the administration of this is a huge burden. We've got to submit receipts and, we're fighting with the employees because they want to get reimbursed, but we don't have the receipts. We've got a technology solution and we administer these in a way where it's going to be the same experience as you would have on a group health insurance plan. Our organization handles all of the payments of the premiums for all of the different insurance companies and ministry sharing plans. And then we've got a technology solution for any of the reimbursements that need to be done. It can come right into an administrative platform and it can all be done seamlessly. So whenever you hear these HRAs, don't think, man, it's going to be a big administration burden, because that's not going to be the case at all. What is a MEC? You heard me when I was talking about a QSEHRA plan. Use the term MEC. It stands for Minimum Essential Coverage. And basically the Affordable Care Act went through and defined the minimum essential coverage that an employee needs to have in order to qualify to be exempt from the ACH penalties. There are organizations out there that have designed what are called MEC plans or PMEC or skinny MECs. They're all virtually the same thing, but they're insurance policies that cover primary care visits and they cover all of your preventative health. So what a lot of organizations will do whenever they're looking at a QSEHRA plan is the employee will go out and say, I want to get the MEC plan that's going to cover my physician's visits, my primary care visits, and then I don't have a very large health insurance spend, so I'm going to do the MEC plan, and then I'm going to do a ministry sharing plan that I can get for a much reduced cost of what I would have to pay to go out and get a major medical insurance plan, and I'll be able to keep my QSEHRA premium cost very low. And what happens inside these HRA plans is if the organization is giving you $600 a month and you can keep your cost to $500 a month, you've got an extra $100 of cash left over inside of your plan on a monthly basis to use for copays for doctor's visits, going to see prescription drugs. Getting prescription drugs. The other one that I just mispronounced is going to holistic or natural doctors. We really see, especially inside of church organizations, a big movement away from going to traditional medical doctors and going to people that practice medicine more of a holistic way. A lot of the employees like to go to those more natural doctors, so they love the idea of keeping their health insurance premium spends low and keeping excess cash left in there where they can go see a doctor that most group health insurance plans wouldn't cover. And then, what is a ministry sharing plan? There's all types of organizations out there that they do ministry sharing plan. It's important to understand there's a difference between a ministry sharing plan and an insurance contract. These are not insurance contracts. It is a group of believers that band together to share their health insurance or healthcare costs. They work really, really well for your employees that do not have a major medical ongoing diabetes, cancer, multiple sclerosis, something like that. If you've got employees that fall into those categories, they need to be on a major medical market insurance plan, either on the individual marketplace or on the group insurance marketplace. Other employees, which are normally the majority of employees that we go in and work with, a MEC plan and a ministry sharing plan can keep the cost really low, and they can get a really, really good outcome from a healthcare standpoint by combining those two resources together. Again, getting back to what I originally said, there's no one solution that is right for everyone, but these are a couple of newer creative options that can give the employees and the organization a lot of flexibility to tackle their healthcare needs. But there's a lot of factors that go into it, and we really have to come in and learn about the organization. This is kind of our strategy spotlight. One Share Health is a ministry sharing plan. They shared $275 million in medical bills. All right. So these are large organizations with a lot of banded together purchasing power. I've used one of them personally for a long period of time. I'm a big believer inside of them. They're not right for everyone, but they can be a really good solution to keep the cost really, really low relative to what you would get inside of the health insurance marketplace. Now, the only last thing that I will say inside of your ICHRAs and QSEHRAs, there's a lot of things that go into making the decision, and we really try to come in and learn your organization. We work with your employees to make sure that they're enrolled. Whenever we take over a plan, we send out a questionnaire before we get on the enrollment call. We ask for prescription drugs that they're taking. We ask for primary care physicians that they're going to. We try to ascertain if they've got any ongoing or anyone in their family has ongoing major medical expenses, because we really do want to match them up with the right solution from both a budget standpoint and a result standpoint. So there's a lot of different things that go into this. What state are you in? How robust is your individual marketplace? Just a lot of things to think through. Unfortunately, healthcare in our country is a very complex and difficult topic to navigate, and that's why we're here to assist you the best way that we possibly can.
That's right. Thank you so much, Gabe. Just want to highlight, I know we spent most of today talking about health insurance. It's because most businesses renew for January 1st, and we wanted to provide this in a timely manner. At BSA, we've got very similar solutions on the property insurance side, property and liability. We've got a partner that has over 5,000 churches, ministries, camps. They've put together, just like we have put together the captive program. They have a special program with Lloyd's of London that they've put together that's exclusively available through them. So want to definitely talk to you about that if we have an opportunity to connect. Background checks and employee screening is a huge thing for churches. We've been working with the largest background check company in the world to bring you a better check at a lower price than what's primarily out there and available through church management systems like Planning Center. So we definitely want to talk to you about any of the areas of distress for you, either from a quality or a cost perspective. I think we're trying to kind of hit all of the major business cost centers that a church kind of runs into, but we want to be your ministry partner. We actually take all of the folks that we have an opportunity to get to know. We have a prayer team that prays over those staffs and those churches and those congregations every week by name, and we just want to continue to lift you up. We cannot thank enough what we know goes into being in full-time vocational ministry, in these times. It's very difficult, and so we just want to encourage you. We want to try and save you some costs, bring you some better quality, have a partner that you can go to with questions. We kind of hit some of the strategies today in rapid fire, but Gabe could probably spend an hour talking through some retirement strategies that are way over most people's head because he cares. He's done the work to be able to make sure that every dollar is accounted for, and as much of those dollars that can be put back into the kingdom and the staff is really what we want to see. So want to encourage you to visit spire.bizsavershub.com. I think it's in the chat as well, that you can go to. You can hear a little message from Rick there. Schedule a time to chat with Tiffany, myself, some of our team, and get you well on your way to taking some of those savings. So, Chaz, did we have any questions you wanted us to hit?
Yeah, Jason asked a couple great questions actually, and so Jason, if you want to pop into and fill in any more that I may miss, but he had two questions. One was, do I have it right? Ministry sharing plans are qualified under a QSEHRA, even though they don't meet MEC definitions.
Yeah, no, that's a great question, Jason. Whenever you're, and I probably didn't explain that as clearly as I should have. Whenever you're using a ministry sharing plan, you need to both purchase the skinny MEC plan or the minimum essential coverage policy. Once you have got the minimum essential coverage policy, that's when the ministry sharing plan, those two can be put together, and they work nicely together, not only from getting you qualified for the tax-free benefits of the QSEHRA, but the MEC plan will cover your primary care visits, and normally the ministry sharing plans do not. So they combine the two of those together, and the cost is normally a small fraction of what a medical plan would be. So you need both of those to qualify for MEC. So that is a good question. And then I saw also you had one other question about, also we have employees in Iowa, Nebraska, Tennessee, and other states. Will the QSEHRA be available to all locations from a single organization? And the answer to that is yes. That is another great thing about a QSEHRA and an ICHRA. You can offer the allowances, and everyone can go out into their own state and buy whatever works best for them. So it's got that flexibility. And ICHRAs, surprisingly or not surprisingly, are actually being implemented by a lot of really large for-profit, large corporations for the exact reason you're alluding to here. You've got a large corporation in Dallas that has a medical plan, and the network is really good for the employees that live in Dallas, but they've got people in the oil field in North Dakota, and it doesn't work as well for those people that don't live in Dallas. A lot of larger organizations are going to QSEHRA and ICHRA plans just because they can give that allowance, and then everyone can go out in their own individual market and pick what's going to work best for them. So absolutely a QSEHRA or an ICHRA you can utilize to buy health insurance in different states.
That's great. Thank you.
Great. Well, if anyone has questions that they have that they thought about, please feel free in the chat or just raise your hand on the in Zoom here, and we'll definitely love to get to you. My question, I've heard you guys both talk about these things before, and it always feels like drinking from a fire hose. And I feel I understand it a little better this time. So you guys do a great job explaining. When we're in open enrollment now, does the QSEHRA and ICHRA, are those changes only available during the open enrollment window, or is that something that in other times of the year can be added on? Help me understand how that works a little bit more.
Yeah, that's a great question. And we do have organizations that during the year will cancel their group health insurance plan, okay, and switch over to a QSEHRA or an ICHRA. There's some complexities of doing that, not necessarily something that I would recommend, but if you don't have health insurance or you do have group health insurance, if you implement either a QSEHRA or an ICHRA plan, it starts what's called a special enrollment period, all right, on the individual marketplace. So if you offer one of those plans to your employees, no matter what time of the year it is, they're going to get an enrollment window where they can go out and purchase insurance on the individual marketplace. So the organization's got the flexibility to switch over to them anytime that they want to, or if you don't have health insurance, you can begin offering them in the middle of the year, and it's not a problem getting them enrolled in the individual marketplaces.
That's great. Yeah, that's helpful. Um,
Yeah. So Chaz, just last thing I want to mention.
yeah.
So my last 15 years, I've been the vice president of national account sales with Allstate Health Solutions, working with really large clients. We put together the platform that's used by QuickBooks for their 1.5 million payroll customers to find health insurance. And when they first came to us, they were looking for a one size fits all solution. And as Gabe mentioned, there just isn't. There's such geographic differences. There's different options based on size. And so, really, what we've put together with Stewarded is a platform very similar where, regardless of the size of your group, where you're located, or what your budget is, we're going to help you find a solution that's going to improve the quality of care that you can offer your employees. So even if you're doing nothing right now, they're buying insurance on the individual market or getting it through their spouse. That could be done tax-free. So that's already some savings that could be created. So please give us a call. We'll talk through the very specific opportunities that you may have. If you've got more than 10, that Kingston plan, being able to save you $100 a month per employee, that could obviously knock some of the savings that you would have for your health plan, or increase what you would want to give in an ICHRA or QSEHRA immediately. So there's some of these solutions that we can combine to make it even better for you as well. So, man, we really appreciate you having us today, Chaz, and the heart that Spire has for helping these churches continue to be equipped, and even on some of the more practical matters. Hopefully, we were providing some information that didn't put everyone to sleep. I know when it gets to talking about insurance versus some of the cool things that you guys are doing with AI and technology and stuff. I love that stuff, but there's a lot of blocking and tackling, and when the second biggest expense most businesses have is their health insurance premium. So if we can help knock that out and bring some savings to you, even if it's not as fun to talk about, we'll make it as painless as possible, and try and help everybody that's on the call. So
Thanks, Josh and Gabe. Appreciate your time today, and it's so helpful. I want to encourage you, in the chat is that link that Josh mentioned, the spire.bizsavershub.com, that you can schedule a time with them and follow up with whatever other questions or your specific context. Also, this is recorded, so I will be sending you the recording in the next couple of days. We are really grateful that you chose to spend part of your time with us today. And thanks for joining us on the webinar. And we're always available if we can help in any way. So thanks for joining.